Welcome to today's Explainer. We are jumping right into the intense clinical journey of traumatic brain injuries. We're going to trace the path literally from the absolute moment of impact all the way through that complex road to recovery. Now, the human brain is an absolute marvel, right? It's shielded by this really impressive anatomical vault. But today, we're looking at exactly what happens when that vault is compromised.
So let's ask a fundamental question. What actually happens when severe mechanical force overcomes the protective barriers of our skull? I'm talking about the meninges, the dura, arachnoid, and pia mater, and that cushioning cerebral spinal fluid. Well, when an external force is simply too much for these built-in defenses, it results in profound and sometimes devastating structural damage to the brain.
To break this all down, here's our agenda for today's Explainer. 1. Basics and risk factors. 2. Impact and clinical signs. 3. Diagnosis and mimics. 4. Emergency and surgical management. And finally, 5. Outcomes and prevention.
All right, kicking things off with Section 1, Basics and Risk Factors, Understanding the Landscape of Trauma.
So what exactly are we dealing with here? A head injury or traumatic brain injury involves physical damage to the brain's delicate parenchyma or its surrounding compartments, despite all our natural anatomical cushions. This mechanical disruption can happen in the epidural space, the subdural space, the subarachnoid space, or even deep within the brain tissue itself. And unfortunately, it's a major cause of morbidity and mortality worldwide.
Now, looking at the epidemiology, a really fascinating demographic split emerges. Young adult males actually have a uniquely high incidence, mostly due to increased exposure to road traffic accidents, which, by the way, are the leading cause globally. Meanwhile, children and the elderly face the highest risks from falls. Assaults and contact sports injuries basically round out the major causes of these devastating events.
And this etiology ties directly into human behavior and some absolutely crucial risk factors. Operating a vehicle under the influence of alcohol, high-risk driving, or just lacking basic protective equipment like a helmet or a seatbelt, these are massive contributors. Honestly, these behavioral choices are often the specific variables that dictate whether a minor scrape becomes a life-threatening traumatic brain injury.
Moving right along to Section 2, Impact and Clinical Signs, the moment of injury.
The key to understanding the pathophysiology here is recognizing it as a distinct two-step process. First, you've got the immediate mechanical primary injury at the exact time of impact. We're talking concussions, cerebral contusions, or diffused axonal injuries where neuronal structures are instantly disrupted. But that's not the end of the story. This is followed by a highly dangerous, delayed secondary brain injury. Developing hours or even days later, this secondary phase involves cerebral edema, hypoxia, and a climbing intracranial pressure that aggressively worsens the neurological damage.
Because of these varying levels of damage, the clinical presentation can vary wildly. A patient might start out just presenting with a headache, some vomiting, confusion, or memory impairment. But severe trauma causing massive spikes in that intracranial pressure, that leads to rapid neurological decline. In those critical cases, doctors are looking for altered levels of consciousness, pupillary abnormalities, hemiparesis, which is weakness on one side of the body, and other direct signs of a literal crushing pressure inside the skull.
To measure this objectively, doctors rely on the Universal Glasgow Coma Scale, or GCS. By rigorously evaluating a patient's eye-opening, verbal responses, and motor responses, they can quickly classify the injury. As you can see, a score of 13 to 15 is mild, 9 to 12 is moderate, and a score of 8 or less, that indicates a severe, highly critical traumatic brain injury.
Which brings us to Section 3, Diagnosis and Mimics, Identifying the True Threat.
Before taking any invasive action in the ER, physicians have to be absolute in their differential diagnosis. They literally must rule out conditions that perfectly mimic head trauma, things like a stroke, sudden hypoglycemia, an underlying seizure disorder, or even severe alcohol intoxication. These can all present with very similar altered mental states and neurological deficits. So careful clinical detective work is absolutely mandatory here.
To get a definitive answer, the immediate investigation of choice is a CT scan. A CT can spot life-threatening intracranial bleeding, skull fractures, and cerebral edema in just a matter of seconds. For more detailed evaluations, especially when they suspect a diffuse axonal injury, where the brain's connective fibers are actually torn, a magnetic resonance imaging, or MRI scan, is brought into play.
But imaging isn't the whole picture. To ensure a comprehensive diagnosis and successfully rule out those tricky mimics we just talked about, doctors gather clues using a specific battery of blood tests. They'll run a full blood count, analyze electrolytes, check blood glucose levels, and run a toxicology screening to identify any contributing metabolic or systemic abnormalities.
Okay, Section 4. Emergency and Surgical Management, the Golden Hour.
In the ER, management moves at lightning speed, using the foundational ABCDE approach. They have to rapidly stabilize the patient to prevent that deadly secondary brain injury from taking hold. This means securing the airway, providing breathing support, achieving circulatory stabilization, conducting a rapid neurological assessment, and fully exposing the patient to check for any associated injuries. Once those ABCDEs are secured, supportive medical management kicks in. This involves providing continuous oxygen therapy, administering intravenous fluids, and aggressively controlling any active seizures. And to specifically target and reduce that dangerous swelling in the brain, specialized medications like mannitol are administered to help manage that critical intracranial pressure.
But sometimes, medicine just isn't enough. If the CT scan detects an epidural, subdural, or intracerebral hematoma, emergency surgical management is an absolute must. Neurosurgeons physically intervene, often drilling right into the skull, to evacuate the pooling blood and relieve the immense mechanical pressure that is actively crushing the brain tissue.
Finally, let's look at Section 5, Outcomes and Prevention, the long-term aftermath. The complications of a head injury are sweeping. Early complications are exactly what the surgical teams fight against: intracranial hemorrhage, brain swelling, and immediate seizures. But the late complications, those are what alter lives permanently. Patients might face profound cognitive impairment, jarring personality changes, and chronic neurological deficits long after the physical wounds have ostensibly healed.
So, what determines the outcome? Well, the ultimate prognosis hinges on a few highly specific variables. While patients with mild injuries often see a complete recovery, the prognosis for moderate to severe trauma relies almost entirely on four things: the initial severity of the injury, how long the patient lost consciousness, the sheer extent of the structural brain damage, and the absolute speed of emergency medical intervention.
Which brings us to the most vital takeaway from this entire explainer: prevention. Because this trauma is largely mechanical and external, simple public health interventions can basically eliminate the risk. Consistent use of helmets and seatbelts, enforcing road safety, securing environments to prevent falls for the elderly, and strict workplace safety measures. These are literal lifesavers. I'll leave you with this thought to end our explainer today. We've seen the incredible anatomical defenses of the brain and the devastating cascade of events when those defenses fall. Your brain's armor is amazing, but it's also deeply fragile against modern mechanical forces. So a split-second decision to wear a helmet really can alter the rest of your life. What choices are you making today to protect your most vital organ?